Hi, I'm Lisa Schmidt, Manager of Employee Benefits for Brevard Public Schools. Today we'll be talking about some important things to know about the BPS health insurance plan. We'll start with what we think is the most important thing for folks to know, and that's that the BPS health plan is self-insured. What that means is that claims aren't paid by a giant faceless insurance company, but our claims are paid by us. All employees and retirees enrolled in the health plan, plus the board, contribute money to the health insurance trust fund, and it's from that trust fund that all of our claims are paid. So when we or our colleagues go for surgery or have other health services rendered, we're all paying for these services for each other. And it's why we feel it's so important for folks to be mindful of where this money is coming from and how it's spent. Any funds we can save on healthcare services can be applied elsewhere in the district, for example in classrooms, or even perhaps to address salary issues. So know that we're paying each other's claims and really try to be the best healthcare consumer you can, and use your healthcare dollars wisely to get the best bang for your benefit buck. Another thing we want folks enrolled in the health plan to know about is that once you make your benefit elections, either as a new hire or during open enrollment, those elections are generally irrevocable, meaning you have to keep them as you elected them. That's an IRS rule that lets us have tax-favored status on our health plan, which means that your health insurance premiums come out of your paycheck before tax. But in exchange for that, we do have irrevocable elections. However, there are some exceptions to that, and those are called qualifying events. If you have a qualifying event anytime during the year, and those are things like getting married or divorced, having a baby or adopting a child, or your spouse or dependent loses or gains coverage from another employer, those are opportunities to come forward and let the plan know you want to make changes. Qualifying events are opportunities to make the change, but what's really important to understand is that you have to let the plan know within 30 days of that event that you want to make a change. If you come at any time after that period, then you'd not be able to make a change and would have to wait until the next open enrollment period or until you experienced another qualifying event. Notifying the plan of these events is easy. Just notify the BPS Benefits Office at extension 11216 or the Benefits Call Center, and you'll be directed on what forms to complete and who you need to speak with to accomplish those changes. A third thing we'd like to point out as being an important facet of the health plan is we really encourage folks enrolled in the health plan to establish a relationship with a primary care physician, also called a PCP for short. We know that a lot of folks don't have these relationships and tend to use urgent care clinics or sometimes even emergency rooms as their point of service for health care. And of course, outside of a true emergency or urgent situation, that's really not the best place to get ongoing, continuous preventive care. And so establishing a relationship with a primary care doctor is important because then you're not only just having your immediate issue resolved, as you would at an urgent care center, but by getting to know a primary care physician and having that relationship, you as a whole person can be treated rather than just having a symptom treated. And so they may be able to learn more about you and your dietary habits, your stress factors in life, just things that affect your well-being overall. Once you establish that relationship, it's good to keep going at least once a year for an annual checkup to keep an eye on things and make sure they don't get out of hand. If you need a hand getting started, just give us a call in the benefits office and we can give you some guidance. Further, we'd like to remind all benefit-eligible employees who even say, "I'm not electing any benefits," and do nothing at open enrollment or do nothing as a new hire, that they still do get a benefit paid for them by the board, which is one time their annual pay in life insurance. So because of that, we encourage all benefit-eligible employees to go into their benefits account and name a beneficiary so that if something happens, you want to be the one to name who would be the beneficiary of those proceeds. Lastly, we'd like to remind folks about the Benefits Education and Call Center. It's available for all employees to call with questions about the benefits program. Their hours are from 9 a.m. to 9 p.m., which gives plenty of time after the workday to contact them. Their number is 321-800-4490. They're always happy to help answer any questions you may have about the benefits program.